this histology of male and female reproductive system is also important for this upcoming exam. Okay. Now, in the structure of the testis, two things are there which you have to understand. The question can come from gross also, and can come from microscopic structure also. Okay. If the question comes for gross anatomy of testis, that means the internal structure of testis, at that time what you have to write. Okay. And if it comes from histology, then what you have to write. Two things, two different way you have to approach. If you remember this particular diagram, okay, that day we have discussed in the lecture hall. If you remember this particular diagram, you can see the internal structure of testis. Okay, it is a sagittal section of testis showing the internal parts. Along with that, you can see the coverings also. Okay, so testis ka what are the coverings? Three layers are there. If you see the testis from outside to in, three layers are there. What are those three layers? First of all, first one is tunica vaginalis. As you can see, tunica vaginalis, which is having two layers, parietal layer and visceral layer, because of the descent of the testis. Next, tunica albuginea. So tunica albuginea is a fibrous layer, and the innermost layer, which is vascular in nature, that is called the tunica vasculosa. Okay, so these three layers are there. After that, you can see the interior. Okay, so this particular diagram and the description for the interior, okay, whatever we'll be discussing right now, that is for the sagittal section of the testis. Okay, now if it is microscopic structure, then the description will be different. In case of microscopic structure, mostly you have to discuss about the seminiferous tubules which are present inside these lobes. Okay, so let's first discuss about the normal structure, internal structure, and then we'll go to the microscopic structure. So two things I am covering over here, and as I said, this part is important. Okay, and this thing already I have shared in the group. It is there, you can check. So if you see the internal structure of the testis, first of all, tunica albuginea is there, which is a thick layer which is covering the testis. Now please keep that in mind. All the layers, whatever it is covering the testis, on the posterior aspect it is deficient. On the posterior aspect you can see these coverings are not there. Why posterior border coverings are absent? Because through that border only blood vessels, nerves has to enter the gland. That's why those layers are absent over there. Okay? That is one point. Next, second important point is, if you see the tunica vaginalis, okay, the outermost layer, okay, after that you can see second layer is the tunica albuginea. So this particular tunica albuginea, what is the function, what does it do, means this tunica albuginea, that you have to know. Okay, after that you can see over here a particular area which is present, that is called the mediastinum testis. Now how the mediastinum testis is formed? Okay. Next, from the mediastinum testis, the septa which are going towards the substance of the testis is dividing it into numerous lobules. Okay. Now those lobules are conical in shape. Apex is directed towards the mediastinum, and inside those lobules what are present? Highly coiled seminiferous tubules are present. 2 to 3 highly coiled seminiferous tubule. Okay. So that should be the approach for the internal structure of testis. Okay. So the tunica albuginea, just now I have shown you the layers. So among them, if you see the tunica albuginea, which is a thick fibrous membrane, first of all will cover the entire testis, okay, and project into the interior from the posterior border as a incomplete partition, and that is called as mediastinum testis. So tunica albuginea projects into the interior of the testis from the posterior aspect, okay, to form incomplete partition, that is called as mediastinum testis. Next, from the anterior surface of the mediastinum testis, the septa will radiate and divide the substance of the testis into numerous lobules. If you take one particular lobule, it is conical in shape. Each lobule roughly conical in shape, and cone, the apex of the cone directed towards the mediastinum testis. Next, if you take one particular lobule, then what you will get? The glandular part, okay, which is made up of approximately 200 to 300 lobules, and inside that what is present? Highly coiled 2 to 3 seminiferous tubules are there. Okay. Now each particular tubule is highly coiled. Now though it is highly coiled, if you stretch it, the length becomes 60 centimeter approximately. Okay, and the diameter is approximately 2.2 millimeter. Next, from the seminiferous tubule, okay, the highly coiled seminiferous tubule, what will happen? They will become 20 to 30 straight tubules which enter the mediastinum. So highly coiled seminiferous tubule, what it will happen? It will go to the mediastinum of the testis. When it is going to the mediastinum of the testis, at that time it is becoming straight tubules. Okay, the number is approximately 20 to 30. Now these straight tubules, they will anastomose with each other in the mediastinum testis, and then that structure is called as rete testis. So as you can see, they anastomose with each other to form a network of tubules that is called as rete testis. Okay. Next, from the rete testis, we are getting 12 to 30 efferent ductules. So from those rete testis, 12 to 30 efferent ductules are arising. From where they will arise? They will arise from the upper pole of the testis. Okay. And they will enter the epididymis. Once they are entering the epididymis, those 12 to 30 efferent ductules, gradually they will convert to one highly coiled duct, and that highly coiled duct will form the head, body and tail of the epididymis. Okay, and that tail of the epididymis is continued as vas deferens. Okay, so here you can see each tubule become highly coiled to form a lobe of the head of the epididymis, and these tubules end in a single duct which is coiled to form the body and tail of the epididymis, and this epididymis is continuing as ductus deferens or vas deferens. Okay. So here is the diagram. Now in this diagram you can see, so what is this? This is the mediastinum testis. From mediastinum testis you can see the septa is going towards the substance of the testis, dividing it into numerous lobules. If you take one particular lobule, it is conical in shape, apex directed towards the mediastinum testis. Inside, so total approximately 200 to 300 lobules will be present inside each testis. Okay. Next, if you see one particular lobule, inside that highly coiled seminiferous tubules are there, 2 to 3 in number. So if you stretch, the length will become approximately 60 centimeter. Okay, and diameter is approximately 0.2 millimeter. Next, those highly coiled seminiferous tubules, they will become straight tubules. Now those straight tubules will enter the mediastinum testis. Okay? Once it is entering the mediastinum testis, they will anastomose with each other to form network of tubules that is called as rete testis, as you can see over here. From this rete testis, we are getting straight efferent ductules, 12 to 30 efferent ductules. Those efferent ductules, they will emerge at the upper pole of the testis. So see, this is the upper pole of the testis, and then they will enter the head of the epididymis. After that, these efferent ductules, they will convert into one single highly coiled duct. Okay, and that duct will form the body and tail of the epididymis. Okay, and then the epididymis will continue as vas deferens. Okay, so that much you have to write for the internal structure of testis. Okay, तो इसमें दो diagrams है. I have added two diagrams. Anyone you can choose, either this one or this one. Anyone? Okay. The last one, why I am also preferring the last one, because in the last one you can see the continuation of the vas deferens, and you can see the parts of epididymis also. Okay. So if you choose this one, you can see the epididymis and you can see the vas deferens also. Okay. So this is all about the gross structure, internal structure of testis. Next, if you have to write about the microscopic structure, then what you have to do, you have to focus on these seminiferous tubules. Okay, you have to focus on this seminiferous tubule. Now in the microscopic structure, first of all, you know that in the coverings, these are the two layers present. Okay, I am not including the tunica vaginalis over here. So we are getting tunica albuginea, and the innermost vascular layer is the tunica vasculosa. Okay. Next, the seminiferous tubules which are there inside the seminiferous tubule, though they are highly coiled. Okay, so inside the seminiferous tubule, what you can expect, two types of cells are there inside the seminiferous tubule. What are these? Sertoli cells and spermatogonic cell. Spermatogonic cell means different stages of development of spermatocytes can be seen over here. And Sertoli cell are the special type of cell, supporting cell, provide nourishment to the spermatogonic cell and removes the residual body also. Along with that, another important function is there of this Sertoli cell. Can anyone tell me what is that? No, nourishment already I mentioned. Formation of spermatozoa, na? Never. It forms the blood testis barrier. Okay, it forms the blood testis barrier. So these are the areas from where you can expect MCQs in the exam. So these are the functions. Along with that, another important function of the Sertoli cells are these cells form the blood testis barrier. Now, why this blood testis barrier is important? Anyone? What is the requirement of this blood testis barrier? Okay, why? Yeah, you are correct. What is the reason behind that? Think, what is the reason behind that? Why this barrier should be formed? No. Haploid other cells are also there. Okay, just think why the blood testis barrier is required. What is the importance? Next, another important type of cells are there. That is the interstitial cells of Leydig. Already you have heard about it. Okay. Now please keep that in mind. ये जो particular cells है, interstitial cells of Leydig, these are not present inside the seminiferous tubule. These are present outside the seminiferous tubule. Okay. That means interstitial space which is present in between the adjacent seminiferous tubules. In that particular space, these cells are there. A function क्या है interstitial cells का? Anyone? They secrete testosterone. Okay. Next, you can see the straight tubules and retitestis. So, straight tubules, inside this we are getting Sertoli cells, and in case of retitestis, it is lined by simple cuboidal and columnar cells. Now, the seminiferous tubule, inside the seminiferous tubule, how many types of cells are there? Only 2 types of cells are there. Okay. Now, if you see the cells, the appearance is complex stratified epithelium. The appearance is complex stratified epithelium. What is the meaning of stratified? Stratified meaning, what is the meaning of stratified? Means multiple layer. Okay. That means if you see the interior of seminiferous tubule, you can see multiple layers of cell. Okay. Can anyone tell me why multiple layer of cells can be seen inside the seminiferous tubule? Yes, because they inside that different stages of spermatozoa are present, primary, secondary, tertiary, like these different stages. So they each and every one will be counted as a cell. Along with the Sertoli cells are also there. That's why the arrangement is, appearance of the arrangement is in multiple layer, stratified. Okay. Next, it consists of 2 types of cell, Sertoli and spermatogonic cell. Diameter already I have mentioned. Now, the Sertoli cell, you know, different functions are there. Among them, another important function is the cell-to-cell junction. Okay, and that junctional complex is forming blood testis barrier. Now, the question is, what is the importance of this blood testis barrier? Now, that isolate the haploid germ cell from the immune system, and this is called as secluded antigen, or also called as hidden antigen. So, the spermatogonic cells, whatever it is present in our body, okay, it is hidden from the immune system. So, if it is not in contact with the immune system, okay, the immune system will treat it as an antigen. Though it is hidden from it, that's why it is called as secluded antigen. Okay, if it is exposed to the immune system, it will produce antibody against it. Okay, that's why this particular blood testis barrier is very important. Next, this Sertoli cells, they are also having an important receptor that is called FSH receptor. इसका function क्या है? Now, FSH activate the Sertoli cell for the secretion of anti-Mullerian hormone. इसका function क्या है? What is the importance of this anti-Mullerian hormone? The Mullerian duct. We know that most of the female reproductive system is developed from Mullerian ducts. Okay. So, in case of male also Mullerian duct develop. But due to the presence of the anti-Mullerian hormone, this Mullerian duct regresses. or it degenerates, it can't grow. That's why those structures are absent in case of male. So that is also important function, and that function is done during intrauterine life. Okay. Next, you can see different functions are there of the Sertoli cells: secretion of androgen binding protein, secretion of inhibin that inhibits the FSH release, support and nourishes the germ cell, phagocytosis of residual bodies after spermatogenesis. So these are also some important functions of the Sertoli cells. Now, this is a very beautiful diagram showing the internal structure of the seminiferous tubule. So inside the seminiferous tubule, mainly, as I said, two types of cells are there. Okay, what are these cells? Sertoli cells and spermatogonic cell. Now, if you concentrate over here, so you can see this is one Sertoli cell, this is one Sertoli cell, this is one Sertoli cell. Okay, in between the Sertoli cell, you can see these are the junctional complex. Now, this junctional complex, particularly, they are forming the blood testis barrier. Okay. Next, when the junctional complex is formed, the lumen of the seminiferous tubule is divided into two parts, or you can say two compartments. So the upper compartment is called adluminal compartment, lower one is called as basal compartment. Okay. Based on the spermatogonic cells, maturation of the spermatogonic cells, the cells are present in this compartment. Okay. So in the lower compartment, what do you think? What are the cells present? Spermatogonea, they are present. Next, in the upper compartment, primary, secondary, tertiary spermatocytes, these are present, and spermatids are also present. Okay. So in two different compartments, two different types of cells are there. Okay. And as you can see, blood testis barrier is also present. So this particular diagram, okay, this is an easy diagram to understand. Okay, I have searched so many diagrams. Okay, after that, I felt that this diagram is easy to make you guys understand about the Sertoli cells, their junctional complex, blood testis barrier, and the compartments which are present in the seminiferous tubule, and which particular cells are present in which part. So you can see the spermatogonic cells, they are present at the basal part of the tubule, and other mature cells are present at the upper part of the tubule. Okay. Now, another important point in the spermatogonic cell that also you have to understand. Okay, especially whenever you are looking the histology of seminiferous tubule under high magnification. So these spermatogonic cells, how exactly they are arranged? So you can see they are arranged in stratified manner from basal lamina to luminal area. Okay, that means from the base of the lumen to the upper part of the lumen, how it is arranged. The first we are getting spermatogonea or spermatogonic cells, then spermatocytes, primary, secondary, then spermatids, and then spermatozoa. This is how it is arranged inside the seminiferous tubule. Okay, so whenever you are looking at the slide, ठीक है, जो lumen होता है, lumen का जो basal part है, in that basal part you will be getting the spermatogonia. इसके ऊपर मिलेगा spermatocytes, इसके ऊपर spermatids, and then spermatozoa. This is the arrangement of the cells, spermatogonic cells. Okay. Next, lamina propria is also there. This lamina propria is nothing but the vascular tissue. Okay, which is present in between the adjacent seminiferous tubule, cut section of the seminiferous tubules. Okay. Now this particular vascular connective tissue will surround each seminiferous tubule. Okay, fibroblasts are absent, but it contains few contractile myoid cell, and the contraction will help in the movement of the spermatozoa. Next, the Leydig cells are there, also called as interstitial cells of Leydig. The main function is production of testosterone. Okay, now if you see the Leydig cell, these are large polygonal eosinophilic cells with round nucleus, that also centrally placed nucleus. And these cells are not placed singly, clusters of cells will be placed together. Okay, so this is the microscopic structure of testis under low power. Okay, so under low power, as you can see, what is this? This is the tunica albuginea. Then you can see this is the tunica vasculosa, and these are the cut sections. Okay, see, these are the cut sections of the seminiferous tubule. Now inside it, can you see the multiple layer of cells? I hope you can see the multiple layer of cells. यहाँ पे See the multiple layer of cells. So these are nothing but the spermatogonic cell and the Sertoli cell. In order to see it clearly, what you need high magnification. Then only we can differentiate the cells. In between the you can see in between the cut section, this vascular connective tissue can be seen, and these are the aggregations of Leydig cells. Here you can see these are the aggregations of Leydig cells. Now this is the microscopic structure of testis under high magnification. Here you can see this is one cut section of the seminiferous tubule. To see how the cells are arranged. See spermatogonia, then primary spermatocyte, see secondary spermatocytes, then see the location of the spermatids. Okay, that means from the basal part you have to go to the center of the seminiferous tubule, then only you will be getting those cells. Okay, Sertoli cell mostly present at the basal part only. Next you can see the interstitial cells of Leydig. Ye dekho. So this is one seminiferous tubule, this is one seminiferous tubule. In between these two, the interstitial space where the interstitial cells of Leydig are present. Okay, and that can be identified easily. This is also the histology of, this is my schematic diagram showing the histology of testis. Okay, so here you can see this is the tunica albuginea, then you can see the tunica vasculosa. Now what are these? These are the cut section of the seminiferous tubules. Okay, inside that you can see the cells which are present in a form of stratified manner. So here high magnification image is given so that you can compare between both the images. Huh? No, this diagram you have to draw. No, only this one. Both. Exam only this one. Okay. Yeah, only this one. Okay. In practical notebook, both you have to draw. Okay. After testis, what is the next structure? Huh? Nah. After testis, how the spermatozoa is traveling? Nah, before vas deferens, epididymis. Directly it can't go to the vas deferens. After testis, then epididymis, then vas deferens. Okay. So what do you think? What will be present in the epididymis? Now see here, the point is there are very much similarity between the slide of epididymis and the slide of testis. Okay, if you see both the slides, they looks almost equal, almost same. Then how to differentiate between the epididymis and the testis? So in case of epididymis, see the lining epithelium, it is pseudostratified columnar epithelium. Here two types of cells are there, principal cell and the basal cells. So see, principal cells are there and basal cells are there. That also in case of principal cells which are tall, they are having stereocilia. Stereocilia is a modified microvilli. Okay, non-motile modified microvilli. And goblet cells are absent. And in case of epididymis, we are getting a circular smooth muscle layer. Only one layer of circular smooth muscle cells are present, which is absent in case of testis. Okay? And in case of testis, we have seen no lining epithelium is there. But here we are getting the lining epithelium, that is pseudostratified columnar epithelium. That also two types of cells are there, principal cell and basal cells. And principal cells we are getting stereocilia. Okay. So this is the schematic diagram for the histology of epididymis. Okay. Now can you see the structure of the epididymis? Almost it is looking similar to the testis, right? But there are some differences. What are those differences? First of all, if you take one cut section, suppose you have taken this one or this one, first of all, lining epithelium will be different. Okay, so see the magnified view, the lining epithelium, which is pseudostratified columnar epithelium, where two types of cells are there, principal cell and the basal cell. If you see the principal cell, the stereocilia is present. See the principal cell tall, and basal part, you are getting the basal cell. Next to that, we are getting the smooth muscle layer. Okay. And around the cut sections, the connective tissue is also present. So this is the difference. So today during the histo slide demonstration, I will ask you to differentiate between the slide of epididymis and the slide of the testis. Let's see whether you can differentiate or not. Okay, because those things will be there in the exam. Okay, next is the ductus deferens. So after epididymis, what is next? Vas deferens or ductus deferens? Anything? Can anyone tell me from where to where it is extending, ductus deferens? Yes, very good. From where to where ductus deferens is extending? Tail of the epididymis is continuing as ductus deferens. Okay? If you see the length of the ductus deferens approximately 45 centimeter. Okay? I hope you remember about the spermatic cord. Spermatic cord के अंदर क्या रहता है? Do you remember the structures inside the spermatic cord? This is not present. So that's why I am asking. Now the ductus deferens, which is 45 centimeter long, it is conveying the spermatozoa from epididymis to the ejaculatory duct. Now can anyone tell me how the ejaculatory duct is formed? And when the ductus deferens is terminating, near that it is dilated to form the ampulla. Okay, that dilated structure is called as ampulla. Have you heard about seminal vesicle? ये देखो, this is the testis, this is epididymis, this is head, body, tail of the epididymis, then ductus deferens starts. So this is the ductus deferens. Now this ductus deferens at the terminal part, you can see it is dilated to form the ampulla. This is the seminal vesicle. So duct of the seminal vesicle and the ductus deferens, they will join together to form what? Ejaculatory duct. कहाँ पे drain होता है? Yes, very good. Prostatic part of the urethra. ये देखो, this is the prostatic part of the urethra. Over here, it is terminating. Okay, so this is the way how the spermatozoa is traveling. Now, what do you think? What will be present in the vas deferens? Identification of vas deferens is also very important and very easy. Identification of the slide of the vas deferens is very easy. Okay. So what is present in the vas deferens? First of all, thick muscular tube with star-shaped lumen. Now, if you see the muscle coat of vas deferens, it is very thick. Okay. And next important point, the lumen, it is star-shaped. Mucosa is pseudostratified columnar epithelium, same stereocilia is present, and along with that lamina propria is also present. Muscle coat is well developed in case of vas deferens because the active contraction is helping in the transportation of the spermatozoa. Okay? So inner longitudinal, outer longitudinal, middle thick circular. The middle layer is very thick. Okay? In adventitia, loose areolar tissue is present. Now this is the histology of vas deferens. So see the diagram carefully. Okay? So what is this? Star-shaped lumen. Okay? Next, this is the lining epithelium. Pseudostratified columnar epithelium with stereocilia. Okay? Next to that, we are getting the lamina propria, and then this entire part is made up of muscle coat. So muscle coat mein first we are getting the inner longitudinal, middle one is very thick circular, and then outer longitudinal. Okay? And next to that we are getting the adventitia. So histology of vas deferens is very simple, not that difficult. Okay? So as I said, I will be keeping those type of slides which are easy to identify. Now what you have to do, you have to make a list of those particular slides. Okay? And then you have to by heart the lining epithelium. Agar lining epithelium galat hua, then gone. Okay? At least you have to write the correct lining epithelium. Please don't forget that. Okay? So that's why prepare accordingly. And how you will prepare? You will be preparing only this part. Okay, for practical exam. So first you will see the slide, and then important identifying feature. You will write this important identifying features first. So what I am planning is, if 1 minute is less, then we will make it 2 minutes for one slide. Generally it is 1 minute, right? Or 2 minutes. For spotting 1 minute. So let's see if it is less, then we'll make it 2 minutes. So I think within 2 minutes identification and writing the features is more than enough. Prostate gland is a difficult structure, it's not that simple. So it is a largest accessory sex gland, the prostate. Okay. Next, if you see the prostate, conical organ extending from the neck of the urinary bladder and surrounds the beginning few centimeters of the male urethra. Next, if you see the prostate gland, it is made up of 30 to 50 compound tubuloalveolar glands. That is the secretory part, or you can say parenchyma of the gland. And the stroma is made up of fibromuscular tissue. This is how the gland is formed. Next, in the supporting part, it is having two capsules. Okay, inner capsule and outer capsule. So see, prostate is covered by inner capsule, or also called as inner true capsule and outer false capsule. So how the true capsule is formed? Condensation of the fibrous stroma of the gland, and false capsule by the visceral layer of the pelvic fascia. In between these two capsules, we are having prostatic venous plexus. Okay, prostatic venous plexus is present. So here you can see this is the interior structure of the prostate. Okay, so here you can see the false capsule, then you can see the true capsule. So this is the true capsule, this is the false capsule. Okay, false capsule is mainly formed by the pelvic fascia, and this is formed by the peripheral condensation of the stroma of the gland. In between these two capsules, you can see this is the prostatic venous plexus. Okay. Next, if you see the interior of the prostate, mainly three types of glands are there. As you can see, mucous gland, submucous gland, okay, and main prostatic glands. तो ये जो mucous submucous gland है, from there mucus secretion is taking place. Okay, and main prostatic glands, whatever secretions are added to the semen, okay, those are coming out from the main prostatic gland. Now all the secretions, whatever they are coming out, okay, they will go, where they will go, they are drained by the ducts, and those are multiple ducts are there which are draining, and ultimately they will reach the prostatic urethra. Now if you take a section of the prostatic tissue, what you can expect, you can see the follicles. Section of the prostatic tissue, you can see numerous follicles. Now if you see the interior of the numerous those follicles, it is lined by pseudostratified columnar epithelium. So follicles will be there. Inside the follicles, कौन सा epithelium रहेगा? Pseudostratified columnar epithelium. Now those epithelial tissue means internal foldings will be present. Now these foldings after puberty, so the foldings are formed after puberty and in old age, and infoldings of the follicles disappear. Okay, so different changes which are taking place in the prostate, age related changes. Now the follicles, they will drain because secretions are taking place. Now these follicles will drain into 12 to 20 excretory ducts, which will open into the prostatic part of the urethra. And those ducts are lined by double layer epithelium. Superficial layer is columnar, deeper layer is cuboidal epithelium. Next, three different types of glands are there. Already I have shown you what are the three different types of glands present inside the prostate and what is the location. Next, if you see the follicles, inside the follicles, lamellated structure, uniform or lamellated structures are found within the lumen of the follicles, and these are called as amyloid bodies or corpora amylacea. This is the important identifying feature of the prostate, and mostly they are found in older people. Okay, so inside the follicles, round masses of uniform or lamellated structures are found. These are called as amyloid bodies, and these are abundant in case of older individual. Okay, why they are present, what is their function, till unknown. Okay, क्यों रहता है, why it is present, no one knows, but it is present. Darkly stain होता है. Now they are rich in condensed glycoprotein keratin sulfate without any clinical significance. Next, if you see the fibromuscular stroma, mainly it is made up of collagen fibers and smooth muscles. Okay, Next, within the fibromuscular tissue, the septa is also there, which will divide the glandular elements into smaller parts. Okay. Now, what is the function of the prostate? So, the semen which is produced, 10 to 30% of the fluid of the semen is produced by the prostate. Okay. The prostatic alveoli or the follicle secrete prostatic fluid. Now, what is present in the prostatic fluid? As you can see, acid phosphatase, fibrinolysin, citric acid, prostate specific antigen, all those things are present in the fluid. Okay. Now, the secretions are pumped out by the contraction of the smooth muscle that lie in the fibromuscular stroma, and the fibrinolysins will help in the liquefaction of the semen. Now, this is the microscopic structure of prostate. Okay. So, as you can see, as I said, if you take the cut section, you can see different follicles, and in the follicles you can see mucosal folds which are present inside the follicles. So, see, these are the follicles. Now, follicles are lined by pseudostratified columnar epithelium. Okay. And inside that you can see these are the corpora amylacea. These are the corpora amylacea. Okay. And this is the fibromuscular stroma, which is made up of collagen fibers and smooth muscles. Okay, next is so this is all about the male reproductive system. In female reproductive system, microscopic structure of ovary is there. So, inside the ovary, what you can expect? What will be present inside the ovary? So, microscopic structure of ovary is very simple. Okay? But there are some differences from the testis. For example, here we are getting germinal epithelium. The outermost layer is the germinal epithelium. Germinal epithelium, which is present below the germinal epithelium, a connective tissue layer is there, that is called the tunica albuginea. Okay. And that germinal epithelium is made up of simple cuboidal epithelium. Below that, a connective tissue layer is present, and that connective tissue layer is called as tunica albuginea. Now, this tunica albuginea is thin as compared to the tunica albuginea of the testis. Okay. Next, the substance of the gland is made up of two parts, that is outer cortex and inner medulla. So, cortex में क्या रहेगा? What will be present in the cortex and what is present in the medulla? Very simple. In case of cortex, we are getting different stages of development of oogonia. That means primordial follicles, primary follicles, secondary follicles, Graafian follicles. All those things will be present in the cortex. Medulla में क्या रहता है? Only blood vessels, nerve, lymphatics, all those are present in the medulla. As simple as that. In case of ovary. Okay. So, identification of the slide of the ovary is very simple. Now, this is the schematic diagram of this is not uterus, okay, this will be ovary. This is the schematic diagram of the ovary, microscopic structure of the ovary. So, first of all, you can see this is the germinal epithelium. Okay, this is the germinal epithelium. Now, just below the germinal epithelium, the connective tissue layer which is present, this is the tunica albuginea. Okay, it is present on both the sides. Next, you can see entire substance of the gland is divided into two parts. The outer part is the cortex, this is also cortex, and only small middle part is the medulla. Okay. So, in the medulla what is present? Blood vessels, lymphatic, nerves, all those things are present in the medulla. Okay. So, in the medulla, hilum is present. Through the hilum, those blood vessels, those structures are entering and leaving the gland. Next, if you see the cortex, what you can see in the cortex? Different stages of development of oogonia. For example, you can see the primary follicle, you can see the primordial follicle, then you can see this is the mature follicle. Okay. Now, this is the secondary follicle. Next, what are these? So, what is corpus luteum? Anyone? Corpus degeneration? No. What is corpus luteum? Secondary side. Tat. Corpus luteum. क्या होता है corpus luteum? Two things are there. One is corpus luteum, another one is corpus albicans. Yes. Albicans is the degenerated one. Corpus luteum after degeneration. Okay, it is forming a white fibrotic mass or white fibrotic tissue. That is called as corpus albicans. After ovulation, okay, This is the, suppose this is a mature follicle, Graafian follicle. From here, if the ovulation is taking place, then this particular structure will convert into corpus luteum. Okay. So see, this is how the corpus luteum looks like. So these are the structures which will be seen in the slide of the ovary. So I hope slide of the ovary is easy, it's not that difficult. Okay. In female reproductive system, after ovary, what is the next organ? Huh? Yes, fallopian tube. Then uterus. Yes, very good. So along with the uterus, we have to include cervix also. Okay. So like this we have to go. So first we have seen the ovary, next will be the uterus. Now in the uterus, three linings are there. I am talking about microscopic structure of the uterus. So what are those three linings? Yes, endometrium is the innermost layer, then myometrium and the perimetrium. Okay, so what you can expect in the endometrium? The mucous membrane is called as endometrium. Okay, now in case of endometrium, the epithelial lining is simple columnar epithelium. Before menarche it is ciliated, but after that, due to gradual destruction of the or shedding of the endometrium, it becomes only non-ciliated simple columnar epithelium. Okay. Next, the lamina propria is there, or also called as stroma. In this stroma of the this one endometrium, what we are getting, numerous blood vessels, lymphatics, nerves, and the most important, uterine glands are present. Okay, uterine glands are present in the endometrium. Okay, now why I am giving focus on this particular uterine glands? Because we know that during the follicular stage, during the secretory stage, okay, there are different stages of menstrual cycle. At those stages, there are changes taking place in this particular uterine glands. Okay, in proliferative phase, post-menstrual phase, proliferative phase, and secretory phase. Okay, so in all these three phases, the shape, size, content of the glands are different. Okay, and it can be identified easily under the microscope. Now, glands are also lined by simple columnar epithelium. Okay, and this gland extend into the inner surface of the myometrium. Next, two separate zones are there in the endometrium. That is the outer basal layer and inner functional layer. Okay, so if you see the functional layer, it undergoes changes during the menstrual period, and the basal layer is unaltered, but it helps in regeneration of the epithelial lining after the menstruation. And two different types of blood vessels are present in those layers. What are those blood vessels? The basal layer, straight basal arteries, and in functional layer we are getting the spiral arteries. Okay, now can anyone tell me about the, okay, when we'll discuss the myometrium, and that time I'll ask. Now in case of endometrium, the changes which are taking place at various phases, that you have to know one by one. Okay, and what are the hormones responsible for that. So in case of proliferative phase, see, these are the different changes which are taking place, and I hope you have studied about this. Okay, so what happens in the proliferative phase? One by one changes, and along with that, which hormone is responsible for that, that you have to know, you have to mention. Okay, so now I am not going into this, it will take time. Okay, I have to complete other topics also. Same, you can see the changes of the endometrium taking place during the secretory phase. Okay, previous one is the proliferative phase, next is the secretory phase. Okay, in brief, if you want to know changes which are taking place in these two phases are, first of all, blood supply will increase, the thickness of the stroma will increase, then the size of the gland will also become different. The size of the gland will increase, and then it become tortuous. Blood vessel will also become tortuous. Glands will get filled with lipid and glycogen. Okay, so these are some changes which are taking place in both these phases. Here you can see the post-menstrual phase, proliferative phase, and secretory phase. Just see the differences between the glands. Size, shape, and content. These three things are changing. Okay, in these three phases of the menstrual period. especially in case of the uterine glands. Next about the myometrium. Okay, so myometrium में क्या रहता है? Mainly smooth muscles are there. Now along with the smooth muscle, blood vessels are also present in the myometrium. Now the muscle fibers which are present in the myometrium, okay, they are ill defined, but still the muscle fibers can be identified. And how they are arranged? Outer longitudinal, middle circular and inner reticular. Okay, so outermost is the longitudinal, middle one is the circular and innermost is the reticular. And can anyone tell me what is the most important significance of this inner reticular layer? Have you heard about living ligature of uterus? Or what is living ligature in our body? Girls should know about this. क्या होता है? See, when the menstrual bleeding is taking place, okay, approximately 80 to 90 ml, okay, in some person it may be 100 ml, that is normal bleeding which is taking place. After that the bleeding stops. You are not taking any medication to stop the bleeding. तो कैसे stop होता है? There must be some mechanism in the body, right? तो कैसे stop होता है? Every time means you are not taking medication to stop the menstrual bleeding. No one does that. Then how it stop? Okay, for that the most important role is played by this inner reticular muscle fibers. ठीक है, तो reticular muscle fiber जो होता है ऐसे network shaped होता है like this. So the blood vessels are passing like this. Okay, so three layers are there. Outer one is the longitudinal, middle circular, inner is the reticular. So it has to cross those layers and then it has to reach the endometrium. So in the myometrium, the innermost layer is reticular like, network like. So the artery blood vessel has to pass like this. Now when the blood vessel is passing like this, so one part of the blood vessel is in the endometrium, one part of the blood vessel is in the myometrium. Okay? So when the menstrual bleeding is taking place, at that time what will happen? This part will shed off. Okay? Now from this part, the bleeding which is taking place, the muscle will contract. When the muscle will contract, it will give pressure. It is a type of ligature. That's why it is called as living ligature. Then the bleeding stops. Okay, so that is the important significance of this particular layer, inner reticular layer. Okay? Not only during the menstrual bleeding, during placental separation also, this particular layer is helpful to stop the bleeding. Having different function. Okay, so as you can see, longitudinal muscles are continuous with the corresponding muscles of the uterine tube. Now this will help in anchorage of the uterus and expel the uterine content to the exterior. Expelling the uterine content to the exterior, that is done by the longitudinal one. Middle layer, where the vascular bed is present, that's why it is called as stratum vasculare. Now the circular muscle layers form a sphincter to retain the uterine contact. Okay, so uterine content, to retain the uterine content, the sphincteric action is done by the middle layer, and along with that the blood vessels are also present in the middle layer. What about the inner layer? Just now I have mentioned. See, endometrial blood vessel pass through the interstices of the inner reticular arrangement. Okay. Now on contraction, the muscles stop the bleeding of the menstruation or during placental separation. Now this is called as living ligature of the uterus. So three different layers, arrangements are different, functions are also different. Okay. Next, जो myometrium होता है उसका changes होता है during pregnancy. What are those changes taking place? As you can see, hyperplasia is taking place and hypertrophy is taking place. These are the two different types of changes taking place in the myometrium of the uterus during pregnancy. Okay. Why? Because contraction of the myometrium is responsible for expulsion of the fetus during the normal childbirth, which is also called as parturition. Okay. So these are some important functions of the smooth muscle fibers of uterus. Three different layers, three different functions. Lastly is the perimetrium. The perimetrium में क्या रहता है? It is mainly made up of, perimetrium is made up of what? See, uterus is covered by peritoneum. Okay. Now which part is covered by peritoneum? As you can see, serous coat derived from peritoneum, covers the entire organ except the lateral border and anterior surface of the supravaginal part. Means this two part is not covered by peritoneum. Remaining entire part is covered by peritoneum. So जहाँ पे peritoneum है, that will become what? That will form the perimetrium, or you can say serous coating. And the part where this serous coat is absent, that is formed by the loose areolar tissue. Now here you can see the images of this one, uterus, where the layers you can see. So this is the endometrium. Now this particular diagram is of follicular phase and this particular diagram is for secretory phase. Just see the difference between the thickness of the endometrium. Okay, so here the endometrium is more thick. Next you can see the glands are present over here also, glands are present over here also. But the size, shape and the structure of the gland changes. Okay, and along with that glands become more tortuous in this particular stage. So first you have to identify the lining epithelium, which is simple columnar epithelium. Then this is entire part is the lamina propria, where blood vessels are there, and along with that uterine glands can be seen. So see, these are the blood vessels, these are the blood vessels, and these are the uterine glands. Next, the middle layer, the myometrium. Here also you can see the myometrium, 3 different layers and 3 different functions. Okay. Now here you can see 3 layers of the uterus. Okay, so this is the endometrium. This entire part is the endometrium, where 2 separate zones are there: function basalis, okay, functionalis and basalis. Then this entire part is the myometrium. Okay, and this small part is the perimetrium. Cervix is not that important. We'll skip the cervix. Okay. Now for your reference, let me tell you one thing about the cervix. First of all, cervix, the mucosa of the cervix is thrown into folds. Those are called as palmate folds. Okay. Next, in the cervix, 3 parts are there. First, the innermost part is the endocervix. See, this is the endocervix. Okay. Now, in case of cervix, the lining epithelium is not same. There are some differences in the lining epithelium. Okay. See, the mucous membrane, upper 2/3 of the cervical canal is ciliated columnar epithelium, lower 1/3 is non-ciliated, and the external os is stratified squamous non-keratinized epithelium. Okay, so first ciliated columnar epithelium, then non-ciliated, and then stratified squamous non-keratinized epithelium. These are the 3 different lining, and that stratified squamous non-keratinized is continuing in the vagina also. Okay, next. In the mucosal layer only, you can see the cervical glands. These are the mucus secreting glands. Okay. Now these glands are very important. Why these are important? Because iska jo secretions hai, the secretions will keep the vaginal epithelium moist. Because in the vagina, submucosal glands are absent. Glands are not there. So how the inner lining will get moist and the epithelial lining from the secretion of the cervical glands. Next, you can see this entire part is made up of stroma. Now, stroma में क्या रहता है? Fibrous tissue रहता है, and along with that, smooth muscle fibers are also there. Okay. Now, the elastic component and the smooth muscle fibers which are present, that is very important. Why this is important? Because the cervix is having capability to dilate when the normal parturition is taking place. Okay, that's why this particular part in the stroma we are getting the smooth muscle fibers, along with that elastic fibers are also present. Okay, and lastly the ectocervix, which is towards the vagina, where the lining epithelium is stratified squamous non-keratinized epithelium. Okay, now here can you see some cyst can be seen, Nabothian cyst. So this is this particular part you can ignore, or if you remember the Nabothian cyst, which we have discussed during the time of lecture when I have explained you about the applied anatomy of uterus. Can anyone tell me what are these Nabothian cysts? I know you can't think. These things already we have discussed. In this slide only it is present. No glands, when these glands used to get blocked. Okay, a very common type of cyst, Nabothian cyst, very common. Okay. Lastly, the fallopian tube. Okay. Now, fallopian tube is a mucomuscular tube. 3 layers are there. Lining epithelium, first of all, foldings are there. In that folding, you have to find out the lining epithelium and lamina propria. Okay. So, lining epithelium is ciliated columnar epithelium, and along with that, another type of cells are there. This is called as non-ciliated secretory cells, or also called as PEG cells. Okay. Next, muscle coat, inner circular and outer longitudinal, and completely it is covered by serosa. Now the question is, why this particular type of cells are present? These non-ciliated secretory cells are also called as PEG cells. इसका जो secretions होता है, those secretion helps to provide nourishment to the spermatozoa or the ovum which is passing through the tube. Okay, that's why these particular cells are present. Now here you can see the microscopic structure of fallopian tube. Okay, in the fallopian tube, as I said, this particular part is the lumen, where you can see the empty spaces. Mostly, as you can see, it is covered by the mucosal folds. Now if you take one mucosal fold, suppose you are taking this particular mucosal fold, this is the lining epithelium. This is the lining epithelium. This is the lamina propria. Okay. So lining epithelium is ciliated columnar epithelium. Now in this particular lining epithelium only, some we are getting non-ciliated columnar epithelium, which is having secretory function. For that you can see this particular diagram, the high magnification. Okay, and then you can see this is the smooth muscle layer. In smooth muscle layer, inner circular, outer longitudinal, and outermost is the serosa. Okay, so that is all about the male and female reproductive system.